Hi, I'm Dr. James Thomas. By now you know I receive a lot of emails, and recently I received one from Mustafa. He writes from Libya saying, of course, I'm hoarse. He gives a history to me of, I'm a manager, a social activist, have a lot of children, and I really need to use my voice. A year ago, I lost my voice, and I thought it was a cold, but 3 weeks passed with no improvement. I went to see a doctor. He treated me, and he summarizes by saying, it's been 10 months, I've seen 5 doctors in 3 countries, and most of them tell me to rest my voice, and I know this is going to be hard to believe, but they tell me it's probably reflux. That's what all voice disorders are. It's many, many doctors. And possibly a small nodule. Now, he went to his most recent doctor, and he's included some photos, and his most recent doctor is suggesting a surgery. Now, I can't tell Mustafa what he should or shouldn't do, but I found the email and the photos particularly interesting. Particularly interesting because he's asked me about the quality of his doctor, and these 3 photos explain a lot to me. Here are the photos, and yes, they're a little fuzzy. They're taken with a flexible endoscope, and they've been emailed, so they aren't perhaps perfect pictures. But let's zoom in on them. So here's the top picture. Well, there's a telltale red arrow pointing to a bump on the vocal cord. Now, I didn't mention Mustafa is concerned that this might be cancer. And of course, until something comes off the vocal cord, one never knows. But there are some characteristics about this. It's red and smooth, and it's located directly in the middle of the vocal cord. It's only on one side. And Mustafa has given me the history that he was talking a lot and he suddenly lost his voice. Well, to me, that puts together a story that sounds like a hemorrhagic polyp. We have a pinkish, smooth lesion that could have some blood in it. We'll take a look at the second picture, and this picture is taken as he starts to close the voice box, and we can see this bump standing out. And then in the third picture, when he gets it closed, we actually can now see a potential reason for his hoarseness. That is that this bump, located in the middle of the vibrating portion of the vocal cord, touches the other side, and that's going to create 2 separate segments that vibrate independent of each other, and they're going to cause the voice to sound scratchy or to jump in pitch. Well, I can't guarantee Mustafa what he has, but let me take perhaps a similar patient that I have seen, and let's listen to his voice. This is a young man who gives a similar history of having suddenly lost his voice after an episode of overuse. Now, very specifically, we heard the scratchiness in his voice, but I asked him to do a vocal maneuver of rising up in pitch. Ooh! And even if he's not a great singer, and a lot of my patients aren't, they still should be able to make the voice go up and down, but what we hear is a jump in pitch. Let's listen to it again and see if you can hear the pitch break. Ooh! 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 Did you hear the jump? Well, why is there a jump? Because when the vocal cords come together and they're short, we're going to see that the bump doesn't interfere with the sound. And as we go up in pitch, we stretch the cords, and that bump is going to touch the other side and break it up into 2 separate portions. Let's look at this gentleman's strobe. Well, we can see that there's a bump. It's on one side. It happens to be on his left vocal cord. And at his lowest pitches, it tends not to bother his voice a lot. It causes some roughness every time it touches the other side. And when it touches the other side, that's when we can see that the vocal cord vibration breaks up. And here's the high pitch. Look at that. A ventriloquist. He's making 2 pitches at the same time. One here and one here. I don't know how he's going to market that, but he's got 2 pitches simultaneously, and they are caused by this bump, just like a finger touching a guitar string, putting on it. You can break the vibration up into 2 segments. Let's go to the operating room. Now, I have to tell you the picture is inverted because in the office we're looking from the front, but in the operating room I sit behind the patient tip their head back and look down a tube. So now the front of the voice box is at the top of the picture. And here I've stuck in what's called a 30-degree endoscope, and we can look up at this. What do we see? A red, smooth, clear polyp. It's got a little bit of a whitish area, leukoplakia, or an ulcer here. But what I want you to also consider, besides this very obvious thing, is to look at the vocal cord. And the more normal vocal cord has these very thin blood vessels running the length, so that when this is vibrating hundreds of times a second, the vessels don't interfere with the sound. Now, if you've overused your voice and you've broken them, they will heal and many times be very tortuous like this, and sometimes they will break. And when they break, they fill up underneath the skin with blood, and you get what's called a hemorrhagic polyp. Now we can take a little bit closer look, and now we not only see this polyp, but we see that since he keeps talking, it's banging the other side, and we can see we've begun to break some blood vessels over here, and we can see a little callus forming there as a reaction to this bump touching the other side. I switched to a 70-degree endoscope. We can now look along the length of the vocal cords, and now this looks like a mountain in there. There's the polyp sticking out. Here are some of the broken vessels and the callus on the other side. Well, now the actual operation. I bring in a microscope, and we're going to look down this tube at the vocal cords. We're going to zoom in closer and closer, and we get a good look at it again, this time from head on with the microscope. We're going to turn on a laser, and the guiding beam for the CO2 is red, and we're going to fire a few shots here. This is kind of like a computer game, except it's in real life. And I get to shoot each of these vessels. I like to do that because my feeling is if he keeps talking, these big blood vessels are more likely to break, and I'd like to get rid of them. So I spot weld them closed. Well, here's the meat of the surgery. I grasp the polyp, I pull it towards the center, and I've speeded this up 1,000 times. And I use the laser and try to cut right on the edge of the polyp. I don't think it's a cancer, so I don't mind if the laser gets quite close to it. And I try to preserve the underlying tissue. So the polyp's gone. We put back in the endoscope, and what we can see is I haven't disrupted anything underneath. We still have a translucent membrane called the lamina propria, and that's what this skin is going to grow back across. And if we've done a good, delicate job with the surgery, after the surgery, we'll see everything is smooth, there's nothing sticking out, and when he comes back to the office, we'll see it vibrates well. So here he is several weeks after the surgery. We can see that this left side is now smooth, and that when it vibrates, both the right and the left side are very flexible. And at high pitch, there's nothing standing out on that side anymore. So I can't guarantee Mustafa that what he has is the same thing that my patient here in the US has, but I think that Mustafa can put some trust in the physician that he has, because the physician took very good pictures that explain the hoarseness. So if your physician can explain it to you in terms that you understand, it makes sense, it lines up with what other people have, then I think you can have a certain degree of trust in that voice doctor. Doesn't guarantee he's the best surgeon in the world, doesn't guarantee that I'm the best surgeon in the world. But that's how you make a decision choosing your voice doctor, and I wish Mustafa the best. I'm Dr. James Thomas. If you'd like more information about vocal cord surgery, vocal cord polyps, or your voice in general, please visit voicedoctor.net.